As a heart surgeon with decades of firsthand experience, I've witnessed countless senior patients walk into my office, their faces etched with worry. They arrive complaining of unsettling chest discomfort, a persistent breathlessness that lingers, or a sudden, unexplained fatigue that steals their energy. And time and again, the root cause isn't merely the usual suspects like diet or stress. More often than you'd imagine, the insidious culprit is a medication they've been diligently taking for years, sometimes, ironically, even prescribed to alleviate an entirely different, seemingly unrelated condition. What an alarming number of seniors remain tragically unaware of is that certain common pills, ingested daily by millions over the age of 60, possess the insidious power to quietly damage the heart muscle, dangerously elevate blood pressure, or trigger erratic, irregular rhythms. These medications rarely exhibit immediate, overt side effects, providing a false sense of security. Yet, insidiously, over prolonged periods, they can progressively weaken your most vital organ and, tragically, shorten your lifespan. In this critical video, I will meticulously unveil the 7 most perilous medications that may be surreptitiously harming your precious heart health, often without your slightest realization. This message is not intended to incite fear. It is a profound call for awareness and empowerment. If you, or a cherished loved one, are over 60 and currently taking medications for chronic pain, persistent sleep disturbances, challenging blood sugar regulation, or mood disorders, it is imperative that you watch this entire presentation until the very end. The pill I will discuss as number 1 is both the most harmful and, ironically, the most commonly utilized, appearing in countless medicine cabinets. I am unequivocally not advising you to discontinue any medication without direct medical guidance from your trusted physician. However, you absolutely deserve to be armed with the complete truth, equipped with the knowledge to engage in informed discussions about your own care. So, let us begin our vital exploration systematically, starting with pill number 7. Part 1. The 7 medications that may be harming your heart and safer alternatives. 1. Nonsteroidal anti-inflammatory drugs, the pain reliever with a pressure penalty. Nonsteroidal anti-inflammatory drugs, universally recognized as NSAIDs, encompass widely used medications such as ibuprofen and naproxen. These are commonly employed to address conditions like arthritis, various forms of joint pain, or persistent back discomfort, all prevalent issues experienced by the senior population. Millions of individuals over 60 incorporate these into their daily regimen, often completely unaware of the profound inherent dangers they can pose to the heart. NSAIDs possess the undeniable capacity to elevate your blood pressure and induce fluid retention, both of which collectively impose significant, detrimental strain on your heart. For an aging or already compromised heart, this added pressure can be critically sufficient to trigger serious events like debilitating heart failure or irregular heartbeats. Over prolonged periods of use, NSAIDs can regrettably inflict damage upon blood vessels and diminish kidney function, thereby imposing a further, compounding burden on your intricate cardiovascular system. If you already contend with high blood pressure or are currently taking medications for a pre-existing heart condition, these seemingly benign pills can covertly interfere with your prescribed treatment, potentially negating their intended benefits. You may not perceive the adverse effects immediately, as they can be subtle, yet your heart remains under constant, insidious pressure that is not visible on the surface. This is precisely why I consistently caution my senior patients to exercise extreme vigilance with over-the-counter pain relievers. Crucially, there exist demonstrably safer alternatives for pain management that do not amplify cardiac risk, offering relief without compromise. Always engage in a comprehensive dialogue with your doctor before continuing NSAIDs for more than a few days, ensuring a full understanding of the risks. Pain relief should never, under any circumstances, come at the unacceptable cost of compromising your heart health. 2. Certain diabetes medications. Thiazolidinediones, the blood sugar controller with fluid overload risk. If you are currently managing type 2 diabetes, there exists a specific class of medications known as thiazolidinediones, which prominently includes drugs like pioglitazone. While these medications are specifically engineered to effectively lower blood sugar, they may, with alarming subtlety, insidiously harm your heart. These pills possess the capacity to induce fluid buildup, noticeable swelling in the legs, and can even contribute to the development of congestive heart failure, a particularly grave concern, especially in seniors over 60. Despite their primary intention to meticulously manage blood sugar levels, the concealed risk they pose to your cardiovascular system is profoundly serious and often goes unrecognized. Many seniors living with diabetes already face an elevated, intrinsic risk of developing heart disease. When you introduce a drug that exacerbates this pre-existing risk by causing the body to retain excess fluid, it creates a perilous and potentially life-threatening combination. Even more troubling, these pills possess the capacity to mask the early, subtle symptoms of heart failure, such as unusual or persistent tiredness or mild shortness of breath, making it harder to detect a worsening condition. While some physicians may continue to prescribe them due to their demonstrated efficacy in blood sugar control, it is vital to know that if you have a history of heart disease, or even experience mild, unexplained swelling, this medication can silently accelerate cardiac damage. Always engage in a thorough discussion with your doctor to ascertain if a safer, more heart-friendly alternative treatment is available for your unique circumstances. Your blood sugar management is undeniably crucial, but never at the expense of progressively weakening your most vital organ. 3. Sleeping pills, sedative hypnotics, the dream inducer with a hidden heartstring. Millions of seniors grapple with persistent sleep disturbances, often finding themselves relying heavily on sedative hypnotic medications, including newer drugs like zolpidem, commonly known as Ambien, or older ones like diazepam. While these pills offer the alluring promise of more restful sleep, they frequently come with serious and often underappreciated consequences for your heart. Sedatives act by systematically slowing down your entire nervous system, which inherently includes a direct impact on your heart rate and blood pressure. While this might initially sound beneficial for achieving rest, it paradoxically diminishes your body's intrinsic ability to appropriately respond to stress or fulfill oxygen demands during the critical hours of sleep. Over time, prolonged use of these drugs can either induce sleep apnea or dangerously worsen existing sleep apnea, a perilous condition where your breathing repeatedly ceases for short intervals during the night. This intermittent cessation of breathing places extreme, intermittent pressure on the heart and can culminate in perilous heart rhythm disturbances, arrhythmias. Furthermore, these medications possess the capacity to interfere with essential heart medications, such as beta blockers, thereby rendering your vital cardiac treatment less effective and potentially leaving your heart vulnerable. The risk of falls, sudden confusion, and exacerbated breathing problems significantly escalates with advancing age, particularly for those concurrently taking other medications that may compound these effects. While the imperative to address poor sleep is undeniable for overall well-being, long-term dependence on sedatives can insidiously harm both your brain and your heart, often without clear, immediate signs. There exist numerous natural and demonstrably safer methods to enhance your sleep quality without incurring such detrimental side effects or risks. It is crucial to engage in a comprehensive dialogue with your healthcare provider before continuing any sleeping pill on a regular, long-term basis. 4. Tricyclic antidepressants, the mood stabilizer with a cardiac risk. We will now address a class of older medications, known as tricyclic antidepressants, which are frequently prescribed for various conditions including depression, anxiety, or chronic pain. Drugs like amitriptyline or nortriptyline were once widely utilized, forming a cornerstone of psychiatric and pain management, but they carry notable and specific cardiac risks, particularly for individuals over the age of 60. These medications have the potential to cause a range of heart-related issues, including irregular heartbeats, arrhythmias, unpredictable fluctuations in blood pressure, and even a dangerous condition known as heart block, where the electrical signals that regulate your heartbeat are disrupted. Over time, their action can directly interfere with the intricate electrical signals that meticulously control your heart's rhythm. This renders them especially perilous for seniors who already have pre-existing arrhythmias or a naturally slow heart rate, as they can compound these underlying vulnerabilities. Furthermore, these drugs significantly elevate the risk of dizziness and falls, which can regrettably lead to serious injury and subsequent complications, adding another layer of concern. Even if the prescribed dosage is minimal, taking them for long periods without consistent and rigorous monitoring can be profoundly harmful. Fortunately, there are newer antidepressant medications available today that are considerably safer for both the heart and the brain in older adults, offering effective alternatives with a better safety profile. Regrettably, some physicians continue to prescribe these older medications either out of established habit or due to factors like cost considerations, overlooking the potential long-term cardiac implications. If you are currently taking a tricyclic antidepressant and experience persistent fatigue, unexplained dizziness, or unsettling heart flutters, it is imperative that you do not disregard these symptoms. Always engage in a forthright discussion with your doctor to ascertain if a safer, more heart-friendly alternative is available for your specific needs. 5. Decongestants, pseudoephedrine and phenylephrine, the sinus relief with a pressure hike. Next, we turn our attention to a common ingredient found in countless over-the-counter cold and allergy medications, decongestants, specifically pseudoephedrine and phenylephrine. Seniors frequently use these to alleviate bothersome nasal congestion or sinus pressure, particularly during seasonal changes or allergy flare-ups. However, these seemingly innocuous pills can pose significant and often unrecognized dangers to your heart. They function by narrowing blood vessels in the nasal passages to reduce swelling, thereby easing congestion. Crucially, however, their action is not localized. They also constrict blood vessels throughout your entire body, including those vital arteries that supply your heart. This widespread vascular constriction elevates your blood pressure and compels your heart to labor with increased exertion, pushing against higher resistance. For seniors, this extra strain can be profoundly perilous, especially if you already contend with pre-existing high blood pressure or heart disease, as it can push your cardiovascular system beyond its limits. These pills also possess the capacity to trigger irregular heartbeats, arrhythmias, or noticeable palpitations. You might experience unsettling jitters, heightened anxiety, or even sudden dizziness after ingesting them. These are often your heart's urgent, albeit sometimes subtle, signals that something is amiss. Many individuals mistakenly presume these medications are safe because they are readily available without a prescription. Yet, the aging process fundamentally alters how your body reacts to various substances, and what once felt harmless in your 40s can now represent a major and unpredictable cardiac risk. Always meticulously read labels carefully and engage in a comprehensive discussion with your doctor or pharmacist before using any decongestant, even for a short period. 6. Proton pump inhibitors, the acid reflux aid with a nutrient drain. Now, let's turn our attention to a medication that millions of seniors rely on daily for a very common and often debilitating issue: acid reflux and heartburn. I'm referring to proton pump inhibitors, PPIs, a class of medications including drugs like omeprazole and pantoprazole. Millions of older adults take these pills daily, often under the firm belief that they are entirely safe for long-term use and without significant side effects. However, recent rigorous studies have revealed a concerning truth. Prolonged consumption of PPIs can unfortunately increase your risk of developing heart problems. PPIs effectively reduce stomach acid, which is indeed beneficial for alleviating reflux symptoms and discomfort. Yet, that very stomach acid is also absolutely essential for the proper absorption of several key nutrients from your diet, most notably magnesium. Low magnesium levels, a common and often overlooked consequence of long-term PPI use, can tragically lead to irregular heartbeats, arrhythmias, persistent and debilitating fatigue, and even noticeable muscle weakness. Over time, chronic PPI use can also disrupt the delicate balance of your gut microbiome and contribute to widespread systemic inflammation, a factor directly and intrinsically linked to the development and progression of heart disease. If you have been taking PPIs for more than a few weeks, and especially if you are over 60, it is critically important to reassess these medications with your healthcare provider. They should ideally be utilized only for short-term relief, unless their absolute necessity for a specific medical condition has been definitively established and is being closely monitored by a professional. If you are experiencing persistent heartburn, collaborate closely with your doctor to find the root cause of your symptoms and address it directly, rather than merely masking it long-term. Your long-term heart health must always remain the paramount priority. 7. Calcium channel blockers, the heart rate regulator with a hidden slowdown risk. Let's conclude our discussion with a category of medications frequently prescribed for serious conditions like high blood pressure, chronic chest pain, angina, or irregular heartbeats, arrhythmias. Calcium channel blockers. However, specific types within this class, particularly older generations like verapamil and diltiazem, can pose significant and often under-recognized risks for seniors. While these pills are undeniably effective at relaxing blood vessels to lower pressure and ease the heart's workload, they also possess the capacity to excessively slow down the heart rate. For older adults, whose intrinsic cardiac function may already be somewhat reduced or less resilient, this can lead to dangerously low heart rates, bradycardia, unsettling dizziness, and even sudden fainting spells. Over time, prolonged use may cause noticeable swelling in the legs, edema, shortness of breath, and further exacerbate existing changes in heart rhythm. A critical concern is that some calcium channel blockers can unfortunately interfere with other crucial medications seniors often take, consequently increasing the risk of unforeseen complications and adverse drug interactions. The most pressing issue is that many seniors are prescribed these powerful drugs without consistent, rigorous monitoring. Consequently, potential adverse effects such as fatigue or swelling are often mistakenly attributed to just getting old or the natural aging process, rather than correctly identified as a direct consequence of the medication itself. If you are experiencing unexplained fatigue, noticeable swelling in your extremities, or a consistently slow pulse while on these medications, consider it a vital and urgent warning sign. Never, under any circumstances, discontinue heart medication without direct supervision from your doctor, as this can be dangerous. However, always and proactively inquire if a newer, potentially safer alternative exists for your specific condition that may offer similar benefits with fewer risks. This class of pills is powerful, but it demands close and continuous oversight from a medical professional. If you are over 60 and currently taking any of the medications we have discussed today, I am unequivocally not instructing you to discontinue them on your own. That is a decision only your doctor can make with you. However, I am urging you, with the utmost seriousness, to engage in a forthright and comprehensive discussion with your doctor. These powerful pills were meticulously designed to provide therapeutic benefit and address specific health concerns, yet when consumed long-term or without diligent, ongoing monitoring, they possess the capacity to insidiously damage your heart. As a heart surgeon, I have witnessed far too many seniors hospitalized, not primarily due to their original illness, but tragically due to the unforeseen and preventable side effects of their medications. Our common goal here is not to instill fear, but to promote prevention and informed decision-making. With the right awareness and appropriate medical support, you have the innate power to protect your heart, potentially live longer, and undeniably feel better, more vibrant, and more energetic. If you found this video truly helpful, share it with your loved ones to reach more people, and subscribe to our channel for carefully curated life-saving tips tailored for seniors like you. Take care of yourself and keep your heart strong, because your health is truly your greatest asset. We love you.